Now we come to the wind. Climatic wind could cause a local block, or it can affect organs of the wood element, liver, and gallbladder. So sa first tower diagram, which is acute, we need to, sa treatment, we need to sedate the young, which is the wind elimination points. And next, we have the acute tower diagram. We need to sedate the young, wind elimination points. And next, we have the subacute, decrease naman siya, yung yin. We need to sedate the yang and tonify the yin, which is the wind elimination points. And last, the tower diagram, we have the chronic. Mababa na po yung yin, so we tonify the yin, wind elimination points. Wind symptoms can manifest in any organ system. Wind symptoms are irritating, wandering, paroxysmal, and blocking. Moxa to be used only in damp situation without heat. Sa irritating, symptoms of irritating are sneezing, itching, photophobia, phonophobia, aversion to wind on skin, also with emotional irritability. All allergic reactions are wind symptoms. Next, wandering. These are symptoms that move through the body. Typical examples are wandering pains in rheumatoid arthritis, fibromyalgia, or dermatitis that wanders around without a fixed loci. Paroxysmal, as wind comes in gusts, wind symptoms also appear and disappear suddenly. So any suddenly appearing headache, epileptic fits, sudden allergic reactions, and paroxysmal pains as in trigeminal neuralgia, colic, bronchospasms are good examples of this. Next, we have blocking. Wind can either sensory organs such as ears or nose and get blocked there, not being able to get out. This can also block nose or ears. It can also get in through the skin pores and get blocked in the muscles, causing muscular pain due to drought. At worst, wind can block the exterior acupuncture meridians, creating a situation of unequal energies between the two sides of the body, causing hemiplegia or facial paralysis. Sa treatment, restrict sour food and alcohol. The increased liver yang thus causing indugenous wind. Wind eliminating points. Wind symptoms can be treated locally, especially if they are caused by exogenous wind or when they are localized. The following points can be used for this purpose. GB20 do 16 para sa head and neck. Small intestine 12 for shoulders and arm. UB12 for back, lung, and skin. GB31 for hip and leg. Buffing, 8 wind points for the feet. These are the 4 points on each foot. One of these point, liver 2, is the wind elimination point for the entire body. Point stomach 44 is used against belching. And point GB44 is used in wandering or paroxysmal pains along its meridian. Yung back C naman is 8 wind points for the hands. Wind example, wind cold in the lungs, acute hay fever with sneezing, itching of nose and eyes, urticaria, neurodermatitis, rapid and wiry pulse on lungs. Sa treatment, we use liver 5, which is the loop connecting point, GB40, the U1 for sedation, lung 5, removing heat technique, and wind elimination sedation on appropriate region. Next, tower diagram, wind heat in kidney. Acute wandering pains of many joints, stiffness of joints, feeling cold and numb. Better with warmth and movement. Boost impulse and speed with the person to win slow while fast in kidney. Sa treatment, we use kidney 5 sedation on acute point. Wind elimination, tonification of appropriate region. Since wind is always combined with either heat or cold, when using wind elimination points, one has to be clear with combination it could be. Depending on whether it is wind heat or wind cold, the wind elimination technique is combined with tonification or sedation technique. Okay, another table, we have the comparison between wind cold symptoms and wind heat. So wind cold, we have wandering symptoms or worsening with cold. Example niya is rheumatism. There is a feeling of cold in affected area. It is not important whether the patient has fever or not. There is more black feeling locally, black nose or ear, etc. Watery or white mucus. There is less urine and stool lighter than usual. There is slow and wiry pulse. There is thin white tongue coating and use wind elimination tonification technique. While sa wind heat symptoms, there is wandering symptoms worsening with allergy like eczema and urticaria. There is feeling hot in the affected area. It is not important if other areas are cold. Also, more irritation locally like itching, sneezing, often thick or colored mucus. There is increased thirst, urine, stool darker than usual. There's rapid and wiry pulse. There's thin yellow tongue coating and use wind elimination sedation technique.